Welcome to Tips and Tools. I'm Dr. Carlos, behavior psychologist, and my co-host.
And I'm Dr. Ehsan Garajadaki, clinical psychologist.
And today we're going to be talking all about addiction. We're going to be covering alcohol, illicit drugs, and prescriptions. So we're going to get more specific, as we mentioned in the last show. We're going to dial into the nuts and bolts and find out what's really going on. So let's start. Dr. G.
Yes. Absolutely.
Okay. Yeah. Dr. G, so we're going to talk about alcohol, illicit drugs, and prescriptions. What do you think, what's one of the number one reasons people will go to some of these drugs, whether it's alcohol, like we said, illegal drugs, illicit drugs, or prescriptions? What is one of the number one reasons people go to these things?
Well, that's a good question, and that's why we really have chosen these three categories, because the reasons may vary from category to category. You know, it used to be that people would just get used to or addicted to mostly alcohol. Alcoholic Anonymous is really for the past, 60, 70, 80 years based on this notion of people getting addicted to mostly alcohol. You know, in the past, maybe 50, 60 years ago, people weren't known to get addicted to coke and heroin and or even prescription meds like they're doing today, or marijuana and so forth. Cigarettes would be the second, highest category, if you will, alcohol. And so addiction, if you will, was almost limited, but now it has branched out into these other categories. Prescription med addiction is huge today, and there are good reasons for that. And there are different reasons than why people would get addicted to alcohol. So to answer your question, it really depends on which category we are talking about.
Much more complex.
It's much more complex. But for our viewers, what we can talk about is these kind of differentiate between these reasons based on each category. Let's say alcohol. Well, traditionally, people simply gravitate toward alcohol for a few common reasons, if you will. One of them is, as we know, alcohol has this. First of all, alcohol is a depressant. We know it as a depressant.
So what does that mean
substance,
neurologically?
Which makes you depressed, more or less. But in the beginning, it doesn't. Like for the first couple of sips that you're taking, it has actually this elation effect. It lifts you up a little bit and relaxes you. The reason is alcohol increases GABA. GABA is a neurotransmitter in our body and brain. And when GABA is increased, anxiety is reduced. So worries and anxieties are kind of calmed down. Neurochemically, they're calmed down. So there's this rush that comes over us when we have more alcohol in our body, because GABA shoots up through the roof, and we just neuroanatomically feel, wow, that's good. I'm relaxed. I feel this, euphoria.
And is that why they get, since you said that reduces the anxiety, does that make them also, it's one of the reasons why they become more disinhibited? They can approach that girl that they never would have approached if they hadn't drank alcohol?
Exactly. Well, part of it is the effect of alcohol and GABA and basically reduction of anxiety. But also the second part is that alcohol itself also has disinhibition effect on brain regions. Meaning that by itself is a separate category of an impact that alcohol has. Meaning the part of us that usually is quite active in inhibiting us, if you want to call it morality or moral code of conduct or conscience, if you will, those areas of the brain that are responsible for this have basically been more or less numbed out. They're not as active. Therefore, we are more relaxed around being just our own self. Whatever we do, we are less critical. We are less, when we say inhibitory, is that sense of being critical about ourselves. We want to do something. There's motivation to do something, but something inhibits us. What's that something? That's part of us that's a little bit critical. It's examining what we are doing. When we shut down, which alcohol does, shuts down this self-examination, self-critical self-examination part, this original motivation to do something flows through. It's not inhibited anymore. It's continuing. And for instance, let's say, approaching that girl or guy in a bar, or maybe saying something funny. A lot of people are not that funny, but then when they drink a little bit of alcohol, they become funny because they thought of it, but they inhibited themselves in the first place, thinking, oh, it wouldn't be the right thing to say in this setting. But once they don't have that inhibition, it just comes out. They just blurt out something that was on their mind, and maybe it is funny, right? So
what's wrong with alcohol then? Sounds really good to me.
Well,
you reduce anxiety?
To some extent it does, but then as we know, that what is wrong with it is that in the initial phase when neurotransmitters like GABA or dopamine are released and we feel this rush, we feel this happiness, it doesn't last forever.
There it is.
There it is. That's the catch. So it's a temporary elation, a temporary heighten of feelings, of emotions, of good feelings, of euphoria, but then it cannot be sustained. Now it could be, if you will, if you drink more and more and more alcohol, right? However, alcohol is also a toxic chemical. We have a couple of enzymes that break down the toxic alcohol into chemical that can be metabolized and flushed out of our system, right? But only to some extent. When the more alcohol you drink, the more you tax your system in producing those enzymes and producing this anti-toxicity, but it can last forever. It's not a machine. We're not built like a machine that is supposed to like an assembly line, like that is supposed to create one iPhone after another, a million of them. That's one problem with it. So basically it becomes taxing to the point where the liver starts breaking down. That is in charge of those, producing those enzymes. So the liver starts breaking down, and that's where you get this hangover, right? Because your body is not fast enough in that production of the chemicals that it needs to break down the alcohol, so the toxicity catches up with us, right? And then we have the sense of these toxic materials in our body that take over and ultimately lead us to vomit, or get headaches, or just blurry vision, and also pass out, because now we are numbing our systems, our brain regions, our abilities or functionality, like attention, concentration, memory, and also eye-hand coordination, visual-spatial coordination, movement. Because there's another aspect that impact that alcohol has is this negative impact of the cerebellum, the hindbrain, behind the brain, for movement. Cerebellum in charge of movement, and also inner ears for balancing. All of this system is breaking down, is shutting down, because more alcohol is being taken in, and we are not noticing what we are doing to our body within a short period of time. Now, if you drank a bottle of alcohol consistently over a week, it's a different story, because you have 1 week to deal with it, right? But what do people usually do? It's not like they take one sip of alcohol every 30 minutes. That's not how it works. They go to a bar, they have a couple of 3 or 4 or 5 or 6 glasses, so they get to half a bottle within 2 hours, right? So they're overwhelming the system breaks down, and the symptoms are that you can't move, you can't operate machinery, you have slurred speech, you can't talk well, you don't remember things, you say things you will regret, you do things you will regret, right? All of these are immediate consequences of an overly taxed biochemical, psychological system. So that's the problem with alcohol. Now,
burst the bubble, if you're wondering. Yes, sorry. Bubble's bursted. Can I expand a couple of questions really quick? Sure. Ask a couple of questions to expand a couple of issues.
Definitely.
You talked about the liver. You talked about toxicity in the cerebellum.
Yes.
Does it do anything to the front of the brain?
Oh, absolutely. But the front of the brain, especially the frontal lobe, and what we call the prefrontal cortex, which is right around basically our eye sockets, right behind these eye sockets on top. That is the region of the brain that is responsible for what we call executive decision making. The foremost function of this region is executive decision making, or simply just decision making. And also there are other functions attached to it, but mostly we focus on that decision-making ability, where you would, when you are under the influence, this area, the prefrontal cortex of the brain too, is negatively impacted. You are no longer able to make this good decisions in an, let's say, in a most informed fashion, like you used to. Because if you think about it, this prefrontal cortex is more of a end station where all the information from all the other areas of the brain have to be called in, whether it is the emotions from the limbic area, or memories, or auditory information, or visual information. All of this information from these all other areas of the brain, they have to be called in and kind of consolidated into a prefrontal cortex, where based on all this information, then a solid decision can be made, right? But with the brain being overwhelmed with toxic materials, as well as neurotransmitters that are more or less leading to a different level of functioning, like increased GABA, you're just not worry about anything, even dangerous situations. So if you think about it, you have a distorted sense of reality.
So it could affect your amygdala in regards to fight or flight?
Absolutely. You can easily ignore some information that should be worrisome, but you're just not capable of it because part of your brain is not responding the same way it would if you were not under the influence.
So the car slams the brakes in front of you, you may not respond as quickly.
Which is the delay effect of alcohol. Basically, simply taking information, and it takes some time. Because again, it's like you are in a debilitated state of functioning, debilitated, I would say almost like retarded. It's hard to use that word, but it's what it is. Disabled, the retarded, debilitated state of mind.
Let me ask you this. Employers are probably going to watch this. Mm-hmm. Now, we talked about when they're drinking. We got the half a bottle in.
Yeah.
It starts affecting all those areas that you just talked about, prefrontal cortex, cerebellum. Can you do damage to those areas over a period of time? In other words, can the employee, let's say a manager, whatever it may be, vice president, they're drinking for year after year, can it start causing problems in that prefrontal cortex for them not to make the best decisions that they could have made?
Alcohol has not been solidly, I would say, affirmatively connected to brain cell damage, except like general brain cell damage, except hippocampus, and also it is highly linked to vitamin deficiency, especially thiamine. So there's something called Korsakoff-Wernicke syndrome. The Korsakoff-Wernicke syndrome is seen in alcoholics who, after prolonged use, 10, 20, 30, 40 years of use, and we're just talking about the brain. The fact that after prolonged use can lead to liver damage, cirrhosis, etc., that's very well known. But something that may not be very well known is this impact of alcohol, prolonged use of alcohol on the brain to the point of vitamin deficiency. That's also not just a brain function, but also body function. But we know that thiamine and the use of vitamin, the thiamine is necessary for the hippocampus and regions of the brain that are related to memory consolidation and recall. It's necessary for this region to work at their optimal level. So what happens with prolonged use and vitamin deficiency, especially thiamine, is that the regions of the brain that are responsible for memory, they lose their functionality in a very predictable fashion. The Wernicke-Korsakoff syndrome has specific criteria. Basically, the person who is suffering from this problem, they cannot remember recent, past, and which is a retrograde, we call that retrograde memory functionality, and also anterograde memory functionality, which is they can also not learn new material. So if you taught them, let's say somebody who is suffering from this, they come in and you teach them how to operate a machinery. For instance, let's say a new watch, you get an iWatch, or you get a phone and a smartphone, and you teach them how to download an app and send an email and stuff like that. They're learning. You see them, they're learning. But tomorrow they no longer remember it. That's the anterograde memory functionality. So moving forward or going forward,
I think I might have
into
that
the future, you could. And depends how much you drink. But then the retrograde is interestingly too. So if you ask them about most recent memories, for instance, do you remember what happened 2 months ago, 6 months ago, a year ago? Like what did you do on your birthday? Or where have you been in the past 6 months? They would be very foggy for them. They would be confused. They wouldn't remember most of the information.
That's severe damage.
That's severe damage. But if you ask them, what did you do when you were 16? They would remember it. Like if you were asking a 70-year-old, what did you do for your 50th birthday? What did you do when you were 45 or 60? They would remember those events.
Is that representative because it's before the alcoholic incidences?
Well, it is mostly representative, sure. It is certainly because over the past, let's say, 10, 20, 30 years that they have used, they have contributed to that vitamin deficiency. So the memory consolidation and deficiency with the memory consolidation has occurred during the past years, right? Gotcha. But the Wernicke-Korsakoff syndrome is specifically about this combination of deficits, both anterograde and retrograde memory in this specific fashion. It's a very interesting thing, but it's linked to that brain damage, if you will, but not necessarily a direct cell damage. Okay, it's methamphetamine has been linked to cell damage, brain cell damage. Marijuana has been linked to brain cell
damage. You mean an accumulative damage?
Accumulative damage over the prolonged use can lead to accumulative brain cell damage. But alcohol, not so much. There's controversy around that. But
alcohol is more of a ceasing of functioning at the moment or right after the moment of drinking to a certain level. It can impair you.
Right. Okay. Plus it is, as we talked about it, alcohol itself doesn't reach the brain, right? So it is the blood-brain barrier really is responsible for that. Otherwise it would, because it's toxic, it would kill us, right? So alcohol is being processed and metabolized by other organs, right? Kidney and liver and, the basically more or less cardiovascular system, lymphatic, cardiovascular, muscular system are all in charge of taking care of this toxic that comes to the body. And as you said, but then prolonged use ultimately leads to some kind of deficiency. Now, as you mentioned, because it does have this also a little bit of effect on cerebellum, the movement changes, right? People don't have a smooth movement anymore. So you could say vicariously they're also damaging their brain because they could bump into a wall, because they could get concussions.
Coordination, movement.
That can suffer.
Proprioception. Let me ask you this question. That's the physiological. Mm-hmm. We saw the physiological consequences. Right. I want to take you back a little bit to where you originally talked about, where people become more disinhibited, they become more relaxed, and then you said they're actually less critical of themselves initially. It seems, though, and you can correct me if I'm wrong, of course, sometimes when people start drinking through the night, they become depressed and more critical of themselves.
Right.
So it almost kind of reverses and then it puts it into high gear, and they get worse than they were before they drank.
Yes, because the depressive nature of alcohol, we called it a depressant. So alcohol is actually a depressant, but it is being masked in the few first hours of use by the euphoria, by the disinhibition, and reduced anxiety. So all of that is masking the true nature of alcohol. But once that's over, so basically you tell all the jokes you want to tell. You are yourself as much as you want to be yourself. You kind of get to a point where there's not much novelty left, right? And then, so if you will, this inhibition effect and anti-anxiety effect levels off,
Reality
right?
sets
It,
in.
it, it balances off. It kind of it's leveled now to a point where there is no more, if you will, factors that can mask the real effect of alcohol, which is it has been depressing you from the beginning. You just didn't notice it, that it has been depressing you. And now that everything is leveled off, now you kind of can dig deeper into those deeper layers of your mood, which is, oh, things are grim. Things are not happy. The world is not in order. I don't like it. This is the sense of depression. I am sad. And then suddenly your memory, because it is a depressant, where does your memory go? Into sad memories, into self-deprecating thoughts and beliefs, and you're self-critical. And more or less a fatigue sense sets in as well, because again, when we say depressant, it's not only a psychological depressant, but alcohol has also depressed our body, our cells. Our body cells have been put into a fatigued, lethargic state, right? So we don't want to do things. We just want to kind of relax, let go, and kind of plump on the sofa, right? And not move. That's what we want to do. And so that's the depressant nature of alcohol that takes over. And certainly things start getting worse. And now it's like a slippery slope, because for someone who has used alcohol for these purposes in the first place, to feel better than what? Apparently they weren't feeling as good. They wanted to feel better. They wanted to get rid of this inhibition and be themselves, because not being themselves was apparently hurtful or painful to some extent. They weren't themselves. They wanted to feel
what is that?
happy.
What is that? Not being able to be yourself? Is that a lack of confidence, or about their true self, that they don't have the strength or the courage to be themselves? Are they afraid of that?
Yeah, I would say
and then
that
they go to alcohol.
Part of it. That's for everybody. Everybody has different reasons, if you will, their own personal reasons. But I would say, yeah, to some extent, you're right. Where for some people that may be true. I lack confidence in situations because I'm too worried, because I'm too anxious about what people think of me. If I wasn't worried about all that, then I would just focus on being myself, right? So if they discover that alcohol can do that for them, right? That's the other. There are two neural pathways that are in charge of this whole, what we call a cycle of addiction. And now that we're at this juncture, I can talk about these two neural pathways. The first one is that discovery. The discovery of, or actually means of association. There's something called nigrostriatal pathway that connects the substantia nigra to the striatum, which is part of the basal ganglia and limbic system. And that is the connection within the brain that immediately links a substance to a chemical, to a neurochemical, to a neurotransmitter. For instance, alcohol is taken in, it immediately leads to release of GABA and dopamine. So that link is immediately connected and established, and basically the good feelings are produced as an immediate result of alcohol intake, right?
Let me make
That's
sure for
one
the people.
neural pathway.
Dopamine is responsible for
Good feelings.
good feelings.
Right. Dopamine is the one that gives us the euphoria, energy, happiness, all those.
Is that the reward one too? Or is
Reward,
that,
and absolutely, it's involved in the reward system. So basically, we have, and that's the thing. Now, I'm glad that you brought that up, which it links us to the other neural pathway. There's the nigrostriatal is a vertical neural pathway from midbrain to the basal ganglia and the limbic system. And then you have more of a horizontal pathway going from the limbic system and basal ganglia to the decision-making center, the prefrontal cortex.
Oh, wow.
We call that the mesocortical limbic system or mesocortical limbic pathway. So from the middle of the cortex to the limbic system. Now, why is that important? Because it's kind of the observatory pathway. It is linking our conscious, the prefrontal decision-making part of the brain, to the feelings in a way that is also observing what is happening within us from what many people call almost like a reptilian response. The reptilian response being the hindbrain, midbrain, immediate reaction that you have no control over. It's like the survival mechanism, right? That's the reptilian. That there's no thinking involved, no feelings involved. It's just a reaction.
That's not the limbic system. Limbic system is
the mammalian. Yeah,
mammalian
the mammalian part. And then on top of that, you have the neocortex, right? So now these two neural pathways are kind of linking the reptilian to the mammalian to the neo-mammalian, if you will, like a human existence, where our brain suddenly has this, gets caught in this triangle or the cycle, the addiction cycle of having discovered a substance that led to good feelings, and the observatory pathway internally approving of this discovery. Wow, this must be good. That's where the reward comes in. The dopamines come in to play to reward us for having discovered something that makes us feel good.
And then we think it feels good.
Right.
And then it comes back around again.
That's right. And we think it is good. And it's not just thinking it is good. We know it is good.
That's true.
Right? We remember those. But also now it branches into what I would say the part that how we as human beings, as civilized human beings, we contribute to the cycle is our distortions, our irrationality, our selective attention. We tend to think, when I was drinking, I was able to get rid of some problems and issues immediately. I didn't have to go to therapy, an hour of therapy. I didn't have to call somebody to explain a situation to them. It was instantaneous, right? So this selective attention to moments of feeling good within an instance of taking one glass, one shot, and boom, all my worries are gone. All of these are kind of entanglement. It's a sense of entanglement where we ourselves are playing a huge role in it, because we are the ones who are distorting facts. We are the ones who are choosing our selective attention and directing it toward a few evidences, right? A few points of evidence. Like, oh yeah, I felt good. Yeah, I was instantaneous. It's easy. It only costs little. Compared to, well, if I have to go to talk to my boss or my wife or my husband or my kids, it's going to be meticulous. It's going to be taking time. It's going to be maybe even horrific. Maybe I get into fights. It's going to be unpleasant. If I have to go to therapy, I have to pay for this. I have to check my insurance. All those things come into effect.
A lot more work.
A lot more work. A lot more effort that has to go into this. Where if you think about it, to a brain that is programmed over millions of years to be efficient, just doesn't make sense. Why would I go through all that effort, right? Where I can calm myself, calm my anxiety with less cost, more instantaneously, more expeditiously. Why would I go through all that if it's not efficient?
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
We got so much to cover. We only hit the tip of the iceberg on this stuff. It's amazing. We still got to talk about, I don't know if we'll get to it today. We got ethnicity and age differences, but aside from all that, going backwards a little bit.
Yeah.
What I mean by that is it seems like it matters who the person is. And I want you to explain this term to the audience too, because I know a lot of people may not understand what ego strength means. They may think it's a big ego, like a Donald Trump or something. We don't want to do that. But what does ego strength mean? And does it matter? In other words, how much strength that person has, and then all of a sudden falls prey to the things you mentioned about alcoholism, when they feel these good feelings and everything. Because it sounds like to me, if you don't have that, if you don't have very confident, if you don't have good ego strength, you're in a world of pain.
Yeah.
If you start falling for alcohol.
Absolutely.
But what's ego strength?
Well, ego strength is another, let's say, descriptor or definition of a part of our character and personality to withstand adversity based on certain personality factors, such as, let's say, there's something called PF16, which stands for more or less 16 different categories of personality traits, which has been condensed into 5 categories that have been established for many, many years and studied very well, even though there's a lot of controversy about that. But these are pretty good categories that, for the sake of our discussion, we can use. For instance, open-mindedness, conscientiousness, extroversion versus introversion, agreeableness, and what we call neuroticism, or this sense of, let's say, sensitivity, to things. Now, these are 5 different dimensions of characters. Now, if people have strengths rather than deficits in these areas, like let's say they're open-minded and they're open to learn, right? So in terms of adversity, what would a person do who is open to learn? They're not going to easily shy away from that adversity. They're going to say, I'm open to learn. What's there to learn? Yes, this is hard, this is harsh, this is difficult, but I'm open to learn. So what's the worst thing that can come from this? I'm going to learn, right? Openness, that openness would be part of an ego strength, right? Okay. And then in addition to that, you can have a lot of other strengths, and this is just 5 categories. You could go into something we call Milan, multi-axial inventory of personality, MMCI, or clinical inventory, which is going into a myriad of categories, looking at, for instance, let's say if we have a depressive style, if we have a negativistic view of the world, if we have a masochistic or sadistic tendency toward ourselves and others. So going back to the core issue of an ego strength is how much of, like you said, confidence, self-esteem, self-evaluation, self-reliance, and real, if you will, a perspective that is positive, that is constructive, that is strength-based, and almost this can-do attitude, but not just the attitude, also the wherewithal to turn the attitude into reality, to put effort. And it comes back to almost like a willingness and also a lot of motivation. If somebody, they may have the willingness, I want to become the president, but I'm not that motivated to go through the effort of becoming a statesman, right? Or I want to become a pilot, but it takes so many hours of flight instructions and I have to read books after books after books. No, I'm not that motivated. So another aspect of ego strength would be motivation. So if you put all these categories, and I just kind of, like you said, scratch the surface or the tip of the iceberg, there are a lot more categories to an ego strength, then we are certainly talking about the opportunity, the option for a person who has a lot of these strengths to pull through despite adversity. However, this ego strength that we are talking about is not always sufficient, because what we also need on top of strength are skills. Okay, so strength is more, if you will, of a talent and a potential. And we can always become stronger. We can always enhance our strength. But that doesn't mean that we know what to do exactly in a given situation, right? Strength is potential. But turning that potential into actual abilities, like set of abilities, that would become skill building. That's what we call skill building. So let's say I may want to run a smooth business operation. For instance, let's say I want to open a coffee shop, Starbucks or whatnot. Okay, well, I'm dedicated, I'm tenacious, I'm passionate enough, etc. I have the strength to withstand adversity, etc. But managing people, managing shifts, different shifts at different times, knowing how to decorate a room, matching colors, choosing the decoration, the sofa, the tables, ordering materials, and getting rid of waste, making sure that the business is in accordance with city laws and county laws and state laws and health laws. All of those have nothing to do with ego strength. They're skills. You got to go to school. You got to go to some training. You got to go to corporate training. You got to read books. You got to absorb a lot of information and follow certain instructions. And also prove that you know how to follow this, which would require some kind of a certification. Right?
Yeah.
So that's when we really have to combine. That was just an analogy to use in order to understand that we have to combine talent with skills, ego strength with the tools to overcome adversarial situations. So going back to, let's say, an alcoholic or somebody who is struggling a lot with a lot of pain in their lives. They may be a very strong person, but how do I overcome the self-doubt, let's say, or this self-deprecating pattern of self-appraisal that I'm no good, I'm a failure because I've gotten 3 DUIs, I've hurt my family, I almost have no relationship with family because of my drinking. That is a skill that has nothing to do with ego strength. Okay,
interesting.
that's a skill that is a skill that can be gained and learned in therapy, in treatment, in recovery. Why do we have the 12 steps in the AA philosophy? The 12 steps are skill building steps. They're awareness raising steps and skill building steps.
Because alcoholism seems to be, it's not prejudice at all. And what I mean by that is you can be either from a poor socioeconomic environment, you can be a CEO.
Absolutely.
But if your ego strength or skill sets aren't where they're supposed to be,
Right.
it can affect you if you go that route with alcoholism. Yes. And the reason I brought up ego strength is I wanted to start looking down the pathway of where it's coming from.
Yeah.
Because it's really important to have good parenting, good role models to develop that, correct?
Absolutely. It is. It's a combination. We don't live in a perfect world. There are so many different factors that are necessary for healthy life. One of them you mentioned, good parenting. Safe environment. People who grow up in environments that are traumatic, that are toxic, that are unsafe, and kind of tumultuous or war-torn situations, domestic violence, abuse, physical, sexual, emotional abuse, a lot of moving, if you will, volatility, instability. All of these environmental factors during the formidable ages of childhood and infancy, childhood, teenage, young adulthood, and older adulthood, all of that up to about 25 years of age, from birth to 25, we are growing, we are developing. We don't come to the world as a prepackaged adult, right? So during those 25 years, everything has to fit. Everything has to fall in place. But does it? They don't. Which person in the world grows up in a perfect environment where everything falls into place?
Absolutely.
Nobody. Yeah. So therefore, all of us, one way or another, are damaged. one way or another, whether it is financially or emotionally or biologically or psychologically or physically. And by damage, I mean, stressed, if you will, not lifelong damage, but we take a lot of blows from life. It's happening to us, around us. We fall, we hit our head, we go through, let's say, tug of war with siblings, we are bullied at schools, we are stressed psychologically, biologically, we go through sickness. All of this is blows from the nature, from society, from environment, from family environment, from psychological, social environment, where there's a lot of damage, again, just in a category, in an overall category, that we have to withstand. Now, is that a good thing? Actually, it's a good thing. Now, if it's not too intense, well, that's how we grow. We grow. Remember growing pains? Why do we use the term growing pains? Growing right. Comes with pains. This is how our biology has been programmed to withstand damages. And again, another proverb: what doesn't kill you makes you stronger.
Oh, yes. Nietzsche,
right?
Yes.
So we are really programmed to withstand all of these damages, all of these deficits, and relying on our strengths to walk through these obstacles and learn more and learn how to overcome those obstacles, how to make our strengths even more stronger, improve our weaknesses, and as a result, learn skills, learn tactics, mechanics, techniques, strategies to overcome adversity. That's what we are programmed to, and we can do it. And every human being is doing it. But at the same time, it's not a perfect world, and it's not a fun world unless we make it fun. It is...
Well, it seems like you're giving us an option other than alcohol.
Oh, yeah, a lot of other options other than alcohol.
I think sometimes people don't know what to do, where to go.
That's true.
They just drink because it's easy, like you said earlier in the show. It's quick, it's easy, it gets you to solve the problem. Yeah. But now you're starting to give us the answers of what we can do instead of alcohol.
Because that reward mechanism was instantaneous. You see, when our body drinks alcohol and immediately is rewarded with euphoria and with dopamines and GABA, etc., it is so instantaneous that we kind of lose sight of everything else in the world because they take more effort. So it's that part of the efficient mind of the human beings that actually fools ourselves into, right, giving into this instantaneous reward mechanism instead of what we call delayed gratification. This instantaneous satisfaction wins over delayed gratification. However, we can learn to switch that. And many people naturally gravitate to delayed gratification. They're somehow wired differently to kind of detect that I would say their learning is better. They perhaps have a better learning mechanism. They have somehow been growing up in a maybe different context, if you will, or environment, a combination of factors that has taught them, yes, this is great. This is this neural pathway, gimmick or game that is giving me the instantaneous gratification is fantastic and great. However, I also remember it has gotten me into a lot of troubles. And I really don't want that. And there is really another better option there. So this, I would say, mindset, the present-mindedness about all these options that we have, kind of seeing the big picture, the ability to see this bigger picture and being able to compare and contrast in a more mature, I would call that wisdom. Some people have that sooner. A person may be at 12 years old and get drunk and hangover and get up in the morning and hate it for the rest of their lives. I don't want to do that anymore. It was great, fantastic. I got wasted and maybe did lots of things that I never dreamed of, but I don't want to do it anymore. There is that wisdom that tells the person that, there are other things, there are better things. And I should, somehow, they tell themselves, I should pursue that. Now, again, it goes back to that combination. Maybe it's a person who has a higher self-esteem. Maybe it's a person who has higher self-confidence. Maybe it's a person who has better decision-making abilities, right? So there could be many different factors in place at that time that helps a person switch from short-term satisfaction to delayed gratification.
And therapy can help too point out those things that we may not be aware of, right? To be able to give us the insight of why this is a better alternative than alcoholism. And what are the negative consequences to continuing to mask your pain or whatever it is, unresolved hurt, through alcoholism. Therapy kind of lets you see it if you can't see it by yourself, if you don't have that kind of wisdom early on.
That's what therapy is supposed to do. Therapy is not supposed to kind of like some people still continue believe in, which is prove you wrong, find faults with you, and find out what's wrong with a person. But like you said, therapy is supposed to share all these latest findings with a person who may not know. And
it opens your eyes.
It opens your eyes. And it is also to be, I think we have to accept the fact that there's much more information in the world that we are capable of understanding. One person cannot understand everything that's going on in this world. And there's constantly new developments, new information that coming to the fore, and it's too much. It's much more than one person can handle. We can, regardless of the level of education and training we get, we can highly specialize ourselves in one area, but in not all areas, right? Same thing with what we just talked about. If a person is not very good at emotional regulation, let's say they easily get angry, they're too sensitive toward criticism and feedback they get from others, and their approach toward numbing that pain from criticism is to drink alcohol. Well, they may not know that there are other options available that can give them the same benefit but not the negative consequences of alcoholism. So therapy can do that. Therapy can help a person realize these other options. It has nothing to do really with sitting down and figuring out what's wrong with this person, but actually saying, you know what, you have had good reason to drink in the past. Given your history, given what you knew, you did the best you could, but it's not good enough for you. It doesn't work. It doesn't help you anymore. It doesn't get you anywhere. It's causing more problems for you in your life, right? So why not try something different? Why not try something that millions of other people are trying? Does everybody go and drink themselves, to a blackout just because they're angry, or they're disappointed, or they feel lonely, or they feel helpless, or they feel despair? No. What do they do with their emotions and feelings? There are millions of things that can be done. But do you know what those options are? Well, therapy can provide that education.
I like that definition of therapy because a lot of people tend to have that notion, as Dr. G was saying, that something's wrong with me when I go to therapy, and then they won't go because either they're afraid to admit that something's wrong with them. But therapy really gives you a lot of options. It opens your eyes to see other alternative ways of being able to cope with your issues, cope with whatever stresses of your daily lives. I think that's fabulous. And we just barely touched alcohol. We got so much to talk about more.
We only stuck to alcoholism, and we didn't get to prescription drug bit.
Or illicit drugs, that's right.
Yeah, and you started with asking about what are the reasons people drink, right? And I kind of go that way, which is kind of similar to other drugs, but it is a little bit different. So let's maybe wrap up our discussion about some of those differences that are obvious between alcoholism and use of illicit or prescription meds. Sure. Part of it is alcohol is part of food, part of our daily diet, fruit and also hygiene. A lot of also household products contain alcohol. Rubbing alcohol is used for, disinfection. So alcohol is prevalent. It's everywhere. It is available. It's easily accessible. It's part of daily functioning, part of daily life. Alcohol itself. And then alcoholic drinks are part of our ceremonies, part of our culture, part of our the fun aspect of life, part of gatherings, birthdays and weddings and Christmas and New Year and other types of holidays and get-togethers that people just throw parties to celebrate something, accomplishments, graduations, things like that. So it's almost like a symbol of accomplishment, symbol of success, symbol of
Very complicated.
very complicated, and then acceptable. That's the other part. And to some extent, there's a pressure too that we would feel like if you are in a group of friends having fun, people don't just overlook if you're not drinking. They make a point of why you're not drinking, and make a point of you should be drinking. It is pressure that's going on to fit in, to belong, to be the same, to join and connect and kind of create a bond between people. So if you see that, you see how complex alcohol can be. I had one client who was telling me business success is not the same without alcohol. If he, when he closes deals, when he goes out with his friends in order to discuss certain plans that they're making for the future, it's just simply part of that momentary culture or short-term culture, that this is what happens. Alcohol is involved in that. A lot of friends and clients also that I have that golf. They do golfing and there's always alcohol available, and there's a little bit of a difficulty to say no to the alcohol and yes to the golf.
Well, just to make sure, though, just because you use it as a ceremony like that doesn't mean you're an addict in any sense or an alcoholic.
Right.
Something like that person you talked about who likes to go, his business successes can't be the same without alcohol.
Right.
Would you consider that as an addict or somebody who's now just grown? Like, for instance, I like to watch political shows and eat a cookie or two. Yeah. Now I can't watch a political show without eating a cookie. So there's an association created. Is an association for him with alcohol and business success, or is it actually an addiction? Or
no, there's an association. Definitely, there's always association. That's how our the law of effect, if you will, and also the law of kind of classical conditioning and contiguity effect. There's lots of different laws that determine how our brain works, but most of them are based on association. And so there's always association and contingency in play. For instance, as you mentioned, if I go golfing, and it's a different story when I go play golf and also drink versus when I go play golf and not drink. These are two different experiences that have two different flavors because of the law of association, how they're being associated. If I go through my regular business meetings and dealings with my partners where we are brainstorming and coming up with certain, maybe tricks or tactics or strategies to overcome the competition and create the next product, there's always alcohol involved. It's a different type of a brainstorming, different type of a minds coming together than if I was going with the same people in a retreat and there was completely no alcohol and we are talking about a different type of a business plan. So there's always the law of association is there. But so does that mean that we are addicted? Not necessarily. And the proof is, like they say, is in the pudding. If I can shut that off in me, in my mind, without going through withdrawal effects. So I think when it comes down to it, the key differentiator is not just one thing. They're usually what we know in terms of what we call addiction. Actually, itself is not a diagnosis. Instead of addiction, scientifically, we use the diagnosis of dependence. So a person becomes dependent on a substance or a process, and there are usually three indicators. One is an increased tolerance and failed attempt at stopping or breaking that dependence, and then going through withdrawal symptoms when they decide to stop that dependence. So if those three are present, then we can indicate, oh yeah, this person is really dependent. To give you an example, let's say this phone. If I take this away from you for a week, and during that week, you're agitated, you don't know what to do, you're not yourself, you try to do something else, but it fails. Like you have to, instead of going and checking your email on your computer, you get upset and frustrated. You immediately say, no, this is no good. I'm going to go get another cell phone, right?
Yeah, it wouldn't be a pretty picture if I lost my cell phone, that's for sure.
Right. And then again, those agitation is just a benign way of listing some symptoms for withdrawal effects. But now, if you take it a level deeper to alcohol, well, a person may go to play golf, and then they promise, they tell themselves, this time I'm not going to drink, today I'm not going to drink. But then they fail at it. In the end, like they go play golf for 10 hours, they try 9 hours not to drink, but then the last hour they drink. They fail at that,
That's
right?
a challenge, yeah.
And when they drink, it doesn't really taste like it used to. It's not enough. Oh, I had 1 glass last time, but nah, 1 glass is not enough. I got to take 2 glasses. And the third one is, okay, for a person who finally decides to stop, but what happens is because they're no longer drinking alcohol or alcoholic drinks, remember, GABA, neurotransmitter, and dopamine levels are no longer increased. They're reduced this time, right? And what happens? Agitation and frustration and anxiety develops. For people who have been hardcore alcoholics, this can lead to what we call DT, or delirium tremens, which is shivering and shaking, sweating to a point that's all symptoms of heightened hypertensive, anxious reaction of the body and mind and the brain to deficit of neurotransmitters. And it actually can lead to heart failure. People can die from detoxification from alcohol if they're not taking some kind of a medical remedies during that time to help them ease through that detoxification. So those would be some withdrawal effects: heightened anxiety, heightened frustration, heightened agitation, and also bodily symptoms like shaking, right? And again, other things like memory problems, attention, concentration, movement, lots of other things. So once those 3 are present, we say, okay, this person is really dependent on that. So when it goes back to whether a person can be addicted or not, well, we got to look at the situation. Do we have these 3 factors in place or not? And if we do, yes, the person is addicted to that, and people can become addicted to situations and processes, and we can probably end it with that.
Yeah, then we're going to have to get to the differences and similarities the next time.
Absolutely.
But you don't want to miss either.
No.
Dr. G,
Yes.
fabulous stuff.
Thank you, Dr.
Fabulous.
Carlos.
What a wonderful,
Appreciate
wonderful journey through the mind and the body and the effects of alcoholism. Thank you for joining us. Remember, this is Tips and Tools trying to help you guys out, especially with alcoholism, which is a very severe problem. As Dr. G mentioned, it can hit anybody, and it's always available, and it's free, and that's the dangerous part of it. But you really want to build yourself up. Therapy is a great way if you're struggling with life. So come and contact us.
Thank you for watching. We appreciate your time and attention. Thank you for watching Therapy Cable and Tips and Tools on Therapy Cable. Look forward to discussing the next few topics and chapters on addiction. Maybe next time we will address illicit as well as prescription drug abuse.
Absolutely. I also want to talk about the media
Yes.
and how to influence people. Talk to you next time.